All right, so last night I was flipping back and forth between watching Packer game and Bucks game.
Yes.
And obviously, you know, when you're watching a football game, they got their helmets on, you can't really see what they're doing as far as breathing.
Mm-hmm.
But watching the Bucks game, it is just crazy to see how many players out on that court, and even on the sideline. I mean, they flash to the crowd and everything, but like how many people sit there with their mouth open breathing?
Yeah.
Whether they're walking up the court,
Right.
you know, you don't have to be running, but like anybody just doing anything out there, like they're just sitting there, mouth
Yeah.
open.
Correct.
You know, what do you think about that?
Why do they do that? They want to breathe. They want to like open up the floodgates and breathe. And how many athletes? I mean, because we see athletes all the time. How many athletes have the proper tools? Let me stop there and say, well, what are the proper tools? Like, where should they be breathing? So instead of a mouth hanging open,
they should be breathing out of their nose. This is what I always.
Why?
Well, because it's the most efficient way. One, lungs want to see air that's coming through the nose. So if you're thinking about performance and you're thinking about, you know, air that is good for the lungs, which then is good for the blood and oxygenation, you want it coming through the nose because that's the filter, that's the humidifier.
And it's the start of the airway.
Yes.
Why do you have a nose? You know what I mean?
Through, yes.
Yeah. Well, if you didn't need it, you wouldn't have it, and there's a reason that you have it.
And how can you yell at a ref if you're breathing through your mouth?
Well, I guess the core of that is you can't breathe properly unless your nose is working properly. And we were talking about this, you know, earlier from a athlete standpoint. Like every professional athlete, every amateur athlete, every athlete who's on a playing field wants to perform at their best.
Mm-hmm.
And the majority of those individuals are handicapped out of the gate. They have noses that aren't optimized. And in fact, you know, if you're an athlete, you're more likely to be elbowed in the nose, get a ball in the nose, you know, fall on your face, all the things that can kind of mess up your equipment up there. And so you're more likely to have nasal blockage. And yet, how many times do those folks ever get evaluated for that? And it's like almost never, and unless they back into it.
Right. Well, and think about it, because most of the team docs for professional teams are what specialty for the most part, would you say?
Ortho.
Right. So it's not like you have an ENT doc on the sideline who is evaluating that nasal airway, right? All you do is slap a mask on if you're like, you know, Rip Hamilton or somebody else or something, but like you're not looking in their nose and not helping them breathe better. And so.
Yeah, it's out of sight, out of mind, and it's crucial though. Like if you're any type of athlete, if you wanted sort of the secret sauce to peak performance, it's breathing. If you're going to do any aerobic activity, golf, I'd say, could you be a mouth breather and do okay in golf? Probably. Could you be a better golfer? Yeah, you know, could you be a better golfer if you could breathe through your nose properly? I would assume so.
You know, but after you did the procedure on me, I don't feel like I improved my golf game.
It didn't. Well, maybe I don't know.
I need to work harder.
You need to work harder in that. But I think, you know, if you're in like the ones that come to my mind, football, soccer, basketball, stuff where you're running around. I mean, those ones in particular, if you could breathe properly through your nose, it absolutely ups your game. It absolutely makes you a better player, whatever position you're playing. There's a reason. I mean, there's a reason why you see some athletes with breathe right strips on their noses. So they're just trying. And when you have a breathe right strip on, that's fine. It's like it's good. There's nothing wrong with a breathe right strip. I don't want to denigrate it, but the impact that's actually having on somebody's breathing is minimal compared to actually addressing the underlying issues that are there.
And I think also is that, like, you know, I bet most athletes also are thinking, like, if their noses are all jacked up or something, that, hey, I don't want to go have surgery and then have to get this thing hurt again and then redeviate my septum. But the reality is, as we know here, is you don't have to have major surgery to get your nose working. So there are things that are more mellow, low-key that we do in the office that, you know, would have longevity that you wouldn't be at risk for then re-breaking your nose or something and then screwing everything up.
Right, and even, you know, with the stuff we're talking about, office-based procedures, you literally can have something done and not skip a beat training-wise. Yeah. So there's sort of, I mean, for a major surgery, I get it. You know, if you're an athlete, both, you know, taking the time out to have something done, you may not have it, and then the back end of that, as far as recovery, like you may not have it. You know, with most of the office, well, really all the office-based procedures that we do here, it's you know, you're up and running. You can train through that. You can keep doing what you do through that process and get the upside. You know, once your body's healed up. So there's really, I mean, I think point of all that, I think, is that it's a massively underlooked area that is a shame. So like for an athlete that's putting all that work in, like all the training, you know, getting up in the morning and hitting the road, if they're, you know, all the things that go into being a high performing athlete, and to never know that you've been, walking around with weights on your shoulders your whole life.
And they're always looking to get an edge. And
Right.
this is an easy
It's
edge.
an easy edge that every athlete who suffers from this, it should be something that's pushing behind them versus pulling them back.
Right.
And unfortunately, again, I mean, we tend to see folks all through their age spectrum, but we see a lot of folks who, are maybe athlete-wise, maybe aren't at their peak at this point, have done, have gone and done the things they're going to do, and now have said, "Oh, I'm going to take the time to take care of me." And we look in the nose, and boy, did you know that nose that you have had your whole life has really been a hindrance to you? And no, how would you know? How would you know? Kind of a thing. So I think,
and none of the trainers, the doctors, anybody that they're seeing on a routine basis will never have the thought to ask that question. I think, right? Because why would they look in the nose?
Right, because they don't have an action step. So a
Right.
typical doc is going to say, say it's a sports medicine guy who's taking care of a team, or a trainer that's taking care of a team. It's really, if there's an obvious issue nose-wise, they might figure that out and identify it and say, hey, you need to get something done. But in their head, they're thinking, if you got a big issue there and you're going to get something done, then you're not going to be on the playing field on the back end of doing that.
Right.
So it's almost like, let's just sort of bury this thing because we don't want to really find out what's going on. Versus the truth is nowadays identify early so we can treat early, especially if we can do it in the office, so we can keep you or get you, to your peak, kind of a concept. So it really turns everything that I think the sports community typically thinks about noses and the kind of hurdles that you need to clear to think towards doing something. There's no, there's the barrier to entry is low towards, really optimizing performance with, the kind of stuff we're talking about. So
Sure.
I think, we'll come back to this topic, I think, because we just barely scratched the surface. And because there's a lot more to cover. I mean, I think there's a lot more to cover as far as, what are we talking about from a procedure standpoint? Who's an appropriate candidate for some of these things? So we'll get there at some other point. So sports, athletes, noses, all kind of come together. Most people never hear about it. And there'll be more coming at a later date.